In this patient, we have significant disease on the right-hand side with complete opacity of almost all the sinuses on the right. On the left, there's only mild disease with a little bit of opacity within the ethmoid and maxillary. We can see that the frontal ostium is a good size, and when we compare that to the right side, we can see that there's a smaller frontal sinus ostium with significant disease. In the maxillary sinus, there are double densities. We start the surgery on the left-hand side. After opening up the maxillary sinus, the sphenoid sinus, and the frontal sinus, we can see healthy mucosa with good-sized ostia. These are measured. We now perform surgery on the right side. Opening up of the maxillary sinus reveals thick fungal mucus present within the sinus. We try and remove some of this, but it is impossible to remove through the natural ostium. A canine fossa trephine is performed and the straight shot placed through the trephine into the maxillary sinus. Clearance of all of the fungal mucus plus diseased mucosa without exposure of bone is performed. We now proceed to the frontal. Again, we can see severe disease with mucosal swelling present. The frontal ostium is then measured, allowing post-operative correlation. Nothing is placed on the left-hand side as it serves as the control side. We now place Chitogel on the right side. We start in the frontal sinus, applying the Chitogel through the frontal ostium into the floor of the frontal sinus. The gel is placed along the skull base in the ethmoid sinuses. The sphenoid sinus is filled with gel, and then we put gel over the axillary flap to support the axillary flap. The maxillary sinus is then filled with gel. Note how the nasal cavity is not filled with gel, but the gel only applied to the raw surfaces. There's a good airway below the gel, allowing the patient to breathe through that side in the post-operative period. At 2 weeks, we can see on the left-hand side a very nice open frontal ostium, maxillary sinus patent, but there's significant crusting around the posterior ethmoid, and there's pus within the sphenoid sinus. These infected crusts are cleared away. On the right side, the healing is much better. We can visualize the frontal ostium, which is still a little bit edematous, but the ethmoid, sphenoid, and maxillary sinus appear to be healing well. When we look at the left side at 4 weeks, we can see there's still crusting present over the sphenoethmoidal region. The frontal sinus is nice and healthy and patent, but the posterior ethmoids and sphenoid remain infected. When we compare this to the side that actually had worse disease at the time of surgery, the right side, we can see that on the right side we have significant better healing. The frontal ostium is widely patent and the mucosa healthy. The ethmoid cavity is beautifully healed, and we don't see any of the crusting and infection that we saw on the left-hand side, illustrating the healing benefits of Chitogel.